actually looked forward to going like into that hospital and like doing my rotation there. I felt like a med student. I felt like I was a part of that community. I could see myself there. And I was excited. That was the most memorable. Like I can remember it till to this day, like how I felt being in that community, like seeing the nurses work together.
Welcome to the Future Ready NYC Alumni Series. Ambilica, I am so excited to see you. This is like a throwback going back to
I
year
know,
one,
I know.
but would love for you to tell us your name, the year you were a part of Future Ready NYC, the high school you graduated from, and where you landed after high school.
Okay, my name is Ambilica Baldeo. I was class of 2023 at Hillcrest High School. I remember Future Ready being it was like the first, we were for the first batch of kids for the Future Ready NYC internship. Amazing. Right now, I'm at Stony Brook University. I'm doing my third year as my major right now is health science. But we can go more into like what I want to do, like what program I want to do at Stony Brook, because it's a little bit complicated. There's a few pathways I want to go.
Good, good. So when you think about and you think back to that moment of being in the internship, how were you feeling about your future back then?
To be honest with you, I thought I wanted to be a doctor. I thought I wanted to go to med school because that's the norm. That's what everybody thinks they want to do. You either want to become a nurse or a doctor. I did not know of any other profession besides being a nurse or being a doctor because that's all my family would talk about. And being a first generation, like you don't have a lot of options. Like you don't have family that are like doctors and engineers and this and that. So like I wasn't very exposed to other professions besides doctors and nurses. So before the internship, I was not well versed in like different health professions. I thought I wanted to go to med school. Obviously, I was smart. I thought I could, and like I thought I wanted to be a doctor. That's who I wanted to be.
And before the program actually started, what did you think the internship was going to be? Like, what did you think you were going to be doing?
I was actually super excited for the internship because it was my first internship in high school. And when I heard it was in healthcare, I was excited. I thought that I was looking forward to hearing more about other health professions, what it's like being in the healthcare setting. I was looking forward to shadowing in a healthcare setting just to see what it's like, how it works, how the team works together, the communication, how the patient experiences. I was excited. I thought that we were going to do, I mean, and we did, um, a lot of shadowing, a lot of hands-on work, which was really good.
So now you're there. What surprised you most once you were a part of the internship?
I think what surprised me most, if I'm being honest, it's the fact that we were actually allowed to go into the ICU and actually go on the units and see exactly firsthand what the patients are like, how the nurses work. And then we were in the same settings with residency students, medical students. It was just good to see everyone in the same mindset. Like you can envision what college is like. You can envision what going to med school is like. You look at their lifestyle, you see them there, you see how hard they're working, you can ask yourself, is this what it's like? Is this what I want to do? Like you have to envision yourself if you want to go to med school as them because you see what they have to do, their role as a residency student, as an attending physician. And I was surprised to have like that firsthand experience like that. I was shocked.
I love that. Well, a part of the whole point of us having this immersive experience is for you all to see and to interact with the real people who are actually in the field. Now, did anything challenge what you thought healthcare would be like when you participated in the internship program?
I would say maybe like certain smells and like the emotions you get when you're like in certain units, but that's like to be expected, I would think.
And was there a specific either moment, rotation, or experience during the Future Ready NYC internship program that really stuck with you?
The rotations when we were in the city and we were learning how to do CPR on the nurses would come from the hospital. They would come over to the building that we were in. They would teach us how to do CPR on adults, teach us what being a midwife is like. That was my most memorable experience. I actually looked forward to going like into that hospital and like doing my rotation there. I felt like a med student. I felt like I was a part of that community. I could see myself there. And I was excited. That was the most memorable. Like I can remember it till to this day, like how I felt being in that community, seeing the nurses work together.
You a combination of Lenox Hill Hospital and then now Northwell Greenwich Village Hospital. So those were the two areas you were visiting. So
Yeah.
now thinking about that, especially like the ICU experience or even doing, the compressions on the adult mannequins and things like that, what did that moment unlock for you?
It definitely unlocked, like, that hands-on experience that you want as a high school kid. As a high school student, you nobody really if I'm gonna be honest, nobody really trusts you to do hands-on work. They'll tell you about it, they'll explain it, they'll show you how things work and stuff, but I feel like you hardly ever get the chance to do things hands-on. Like, we had the mannequin, and she would tell us where to put our hands and, like, how hard we're supposed to press, how like, we're supposed to count to 30. It was just like that hands-on experience, which I feel like is so vital. It's so vital to actually understand what you're learning in the moment because you see how things work. You see how different airways are being affected in the body as you're doing CPR. And yeah, I think it just unlocked like what I remember thinking, oh, this must be what it's like if I was a nurse. If I decided to go in the nursing major, this is what I'm going to have to do. This is like just a replica of my job as a nurse. And it just opened my eyes. I loved it.
That's beautiful. And now, did it then influence what you chose to study or pursue next?
Yeah, it definitely did. And that's why I loved that internship so much because I never even knew respiratory therapy was a profession until we did one. It was a rotation, but it was not the hands-on one. It was the table rotation that we had to do.
Yep. The
It was
healthcare roundtable. Yep.
yeah, the round table in Forest Hills. I remember, and there was this professor. He was a professor and a respiratory therapist at Hofstra University, and he came to talk to us, and he was talking about his profession, respiratory therapy. And I was like, wow, like I never ever heard of that profession before. I looked more into it. I did not apply to Stony Brook as a respiratory therapy major because I didn't decide fully on it. But now, 3 years later, I'm actually applying next cycle for the respiratory therapy program.
That's awesome.
It's awesome. I never even knew that profession existed. That's why I'm so grateful for this internship because if I did not meet him, if I never even was exposed to these professions, I would not have known that I would want to go through with this career.
Yeah, and you know who that was? That was Stanley John, and he's still with the org. What's funny, Stanley's actually a former client of mine when I used to work at North Shore,
Yeah.
and so he has been truly instrumental in a lot of the work that we do as it relates to the sessions related to respiratory therapy, not only with Future Ready, but I have another program as well that he's been a part of. And so, yeah, Stanley John is the gentleman who spoke with you all at that time. And so I will make sure, I mean, maybe he'll see this, but I will also make sure I tell him directly about the impact that he had.
Like, I never even thought this was a profession. Now look at me, like, I was just looking, like, a few weeks ago when the application was, like, opening and closing, but unfortunately, it closed yesterday, just yesterday. So and all these 3 years, I've just been taking the prerequisites to get into the program. So, I'm hoping to apply for the next cycle, but he really did make a big impact on my career choice.
I love that. I love that. Now, when you think about who you were before the internship and who you are now, what's different?
Before the internship, I was young and I would say now that I look back on it, I was kind of naive to think that I would just become a doctor just like that without exploring other career paths. I think that was a little naive of me, but it's okay. It's not a bad thing to like aim high ever. I don't think so. But like I think I was now well versed with the whole professions and like careers. I really knew what I wanted to do because I don't know, it's just like I always raised to, "Oh, become a doctor," because I was being told to become a doctor, not because I wanted to become a doctor. So kinda like I felt like I didn't know my purpose still, even though, like, I knew an idea of what I like, "Okay, I wanna go into the healthcare field." I just didn't feel like that was my thing, that was not my purpose. So, now, like a few years forward, I feel like now respiratory therapy is something that I am very passionate about. It's just, I don't think I would ever, even if I got rejected, I would just try to make my applications even stronger to go back and apply again for respiratory therapy. I feel like now I know I have a sense of exactly what I want to do, not what people are telling me to do as a profession. So Yeah, I think that's the difference. And now I'm a little bit more mature and I know what exactly I'm looking for in a profession, what kind if I want weekends off, if I want to work 3 12-hour shifts. Like in high school, I did not know any of that information before the internship. But the internship is what opened my eyes up to nurses can work 3 12-hour shifts or like because I thought of everything as oh, a regular 9 to 5. That's what I'm saying. Like as a high school kid, your mind is so closed off to what people tell you, but not what you're exposed to.
I really appreciate that you said that because when we think about our goals for the internship, we hope that it unlocks these types of learnings for
Yeah.
you all, right? And so to hear you say that is validating not only for me, but I'm sure all the facilitators and the leaders who are involved in this work because you are truly why we do this. We want to, and often and you probably heard me say it in orientation and all these things, but we want to expose you to all the opportunities that exist within healthcare because sometimes to your point you just don't know you don't know what you don't know, and so it's up to us to make sure that we're continuing to show
Yeah.
you that. So I love that you mentioned that.
I feel like the internship definitely taught me things that I didn't know outside of school. I didn't know you can pick different shifts or like I just thought of everything as oh 9 to 5, 8 to 4, weekends off. I thought everybody worked like maybe it was just me. Maybe I just wasn't exposed enough. But because of that internship, I saw the different shifts you can work. And that's something that I would not have learned that in school. But
Yeah,
because I had that outside exposure, I was able to learn that little piece of information. Like it's little it may be little for everyone else, but to me, like I would love to work 3 jobs and have like 4 days off. You know what I mean?
yeah, that's key. That is
Yeah.
definitely key. Now, if a student like you were considering Future Ready NYC, the internship, being a participant, what would you want them to know?
I would tell them to take advantage of every opportunity, take advantage of everything that you'll learn, pay attention because you never know. This might be the career path that you'll choose. Just like me, this might be what you want to do. Like look into it outside of like the time when the facilitators are talking to you. This is such a unique opportunity and take advantage of it. Definitely take advantage of it. It can help you decide what you want to do in the future. It may not, but it just may help you decide what you want to do in the future. You never know. And even if it like you don't they don't talk about a specific profession. Like when I was in the internship, I noticed that they were like patient transport. They were not necessarily like a part of the program that they didn't come to speak to us and everything, but I still noticed that they were still a part of that community. That's what I'm saying. Like you should pay attention to everything that's going around you because that might be you one day. You might want to do that. You might want to go down that path.
Yeah, that's a great point. And now if you could say one thing to leaders or partners who support programs like this, what would you want them to understand about the students who are coming through the program?
They need to put themselves in the high school perspective because sometimes I would get tired and sometimes like I didn't always have the same attention span for everyone that was speaking. Like I loved doing the hands-on work and you should do more hands-on stuff because remember like you're coming from school also. So it's just like your attention span is not really the best after school. So it's just like I think the hands-on learning is way more effective than like sitting down and talking. But I will say like the talking is still effective, but the hands-on is more effective.
You told us that you are going the respiratory therapy route, which I'm excited to hear about that and excited to hear about Stanley's impact. Does Northwell still feel like a place you could see yourself?
Yeah, definitely. I actually hope to work there someday, like as a respiratory therapist. Even if I decide to further my education, I hope that I get to work there someday. Like, I did look right now, but I know it's very hard for them to accept people who work part-time in college. So it's okay. Like, I'm a patient girl, so whenever I get my respiratory therapy credentials, then I will definitely apply. I hope I would love to.
So you
Yeah.
know how to reach me and I
Yeah,
know
of
how to reach Stanley.
course.
So that's the beauty of this, right?
Oh, yeah.
Yeah, and to your point, making connections, all those things. As you know, I tell all the students, I give you all my number, I give you all my email address. By
Yes.
all means, please reach out. And so I just really appreciate you sharing all that you did today and sharing your story today.
Of course.
Where you've ended up now as I've been going through this series, it's just so cool to see where you all are at now. But,
Yeah.
but before we wrap, is there anything we didn't talk about that feels important for you to say that you'd want people to know?
I really only have good things to say about that internship, and I hope that every student that whoever gets the opportunity, I hope they take full advantage of it. It's so, so beneficial. Even if you think that this might not be what you want to do, you never know. It's such a unique internship for kids to be like exposed to something like that, and they should take full advantage of it. I know I for sure did. And that's why I'm here now.
I love that. Well, thank you again for
Of
being a
course.
part of the internship program, for lending your voice to this series and this conversation. I think it is something that will really help future students actually see what's possible. So,
Yeah,
Ambilica, thank you so much.
of course.